Now I am going to elaborate health and nutrition in Pakistan. It is true that health and nutrition make important contribution to economic development. Healthy people are more lively, energetic, and effectively contribute in economic progress. Malnutrition, ill health, and diseases are considered as barriers to economic growth. Delivering better health services has continuously been the prime objective of the government. Pakistan has a mix of public and private health service delivery system. Under 18th constitutional amendment, health service delivery has been transferred to the provinces through Pakistan Vision 2025, which was prepared in consultation with provinces, provide a roadmap which includes reducing the widespread prevalence of communicable diseases, disease surveillance, addressing inadequacies in primary, secondary healthcare facilities, correcting rural and urban biases, bridging basic nutritional gaps, and improving the pharmaceutical sector to ensure the availability, affordability, and quality of medication drugs. An intersectoral cooperation and sector-wide approaches are required to achieve the pioneering goals in the years ahead for which there is a dire need to increase resource allocation, strengthening primary healthcare services, and motivating the human resources employed in health sector by good governance. The country's ownership of the SDGs would be a prerequisite for health and development in the future. Cumulative health expenditures of federal and the provinces are estimated at rupees 384.57 billion, which is 31.75% higher than the actual expenditures of rupees 291 billion realized. A brief look into the previous year's performance reveals that total health expenditures increased both in terms of growth and as percentage of GDP. It grew by 29.54% at stand at rupees 291 billion against rupees 225 billion. Health expenditures surpassed the budget allocation of rupees 273 billion, while in terms of GDP, health expenditure increased to 0.91% from 0.77. During the months of July and February, health expenditures consumed 43.5% of budget allocation to reach rupees 167 billion against the expenditure of rupees 121 billion in the comparable period. In terms of growth, it increased by 37.51%. Viewed from GDP, it increased to 0.49% from 0.38 recorded in the same period of fiscal year. It is worth mentioning that current fiscal year has witnessed a considerable increase in budget allocation for health expenditures, showing 40.7% growth by allocating rupees 384 billion compared with rupees 273 billion. According to the breakup of federal and provincial share in total public spending on health, the major share of spending on health has been observed in Punjab, 84.8%, followed by Sindh, 41.4%, and Khyber Pakhtunkhwa, 17.6%, and Balochistan, 11.3%. Prime Minister Health Programme was launched initially in 23 districts, and under Phase Two, the services have been expanded to 40 districts to cover 14 million families. The program is a milestone towards social welfare reforms, ensuring that the underprivileged citizens across the country get access to medical health care in a swift and dignified manner without any financial obligations. The funding for the program is being provided by the federal and provisional governments. A total amount of rupees 15 billion was allocated for the two phases of the program. As of 31st January 2018, families have been enrolled in Prime Minister's National Health Program, and more than 56,000 families have been treated for various illnesses from 125 empaneled hospitals across Pakistan. All forms of hepatitis are of concern within public health framework. The program envisages meeting the challenges posed by the high prevalence of viral hepatitis in the country and 50% reduction in new cases of hepatitis B and C through advocacy and behavior change communication. Hepatitis B vaccination of high risk groups, establishment of screening, diagnosis and treatment facilities in 150 teaching and DHQ hospitals, safe blood transfusion and prevention of hepatitis A and E. Safe Blood Transfusion Project with the Technical Corporation of German Society for International Cooperation is under implementation in all four provinces, which will be helpful in addressing the hepatitis issues in the country. Through polio eradication efforts, a substantial investment has been made in strengthening health service delivery system in Pakistan. Thousands of health workers have been trained, hundreds of volunteers have been mobilized to support immunization campaigns, and cold chain transport equipment has been refurbished. Polio incidence has almost been eradicated in Pakistan. It is evident that during calendar year 2011, there were total 198 polio cases that were reduced to 8 in 2017, and during first quarter of 2018 only one case is observed in Balochistan. Series of programs and projects are on track in Pakistan to improve health status of the people and to reduce burden of communicable and non-communicable diseases. While vertical programs in health sector have been devolved to the provinces, The funding for these vertical programs is still created by the federal government. Investment in health over years have been improvement in health facilities and healthcare providers. By the year 2017, the number of public sector hospitals has increased to 1,211, 5,508 basic health units, 676 rural health centers, and 5,697 dispensaries. These facilities, together with doctors, dentists, and nurses, being the current ratio of one doctor for 957 persons, 9,730 persons per dentist, and availability of one hospital bed for 1,580 persons, and shows that number under each establishment is increasing. The achievements of the health sector during 2016 to 17 included establishment of 3,100 hospital beds, 5,000 new doctors, 500 dentists, 3,200 nurses, 4,500 paramedics, 450 traditional birth attendants, and 9,000 lady health workers. Under the National Expanded Program for Immunization, about 7 million children were immunized and 8 million packets of ORS were distributed during 2016 to 17. The target for the fiscal year 2017 to 18 is 4,000 hospital beds, 5,000 new doctors, 700 dentists, 4,000 nurses, 5,000 paramedics, and 1,000 traditional birth attendants, and 8,000 lady health workers. Under the preventive program, about 8 million children will be immunized and 25 million packets of ORS will be distributed. Lady health workers' services have visible impact on the health status of women and children, in particular through improved hygiene, birth spacing, iron supplementation, greater immunization coverage, and through antenatal and postnatal coverage of the pregnant women. The program has recruited more than 1,16,000 LHVs. The total population covered under this program spread over 60% in Balochistan, more than 80% in Punjab, 65% in Sindh, and 60% in Khyber Pakhtunkhwa. A PC-1 of provisional as well as special areas government are in approval process in which salary packages of the staff of this program have been increased through regularization of their services in compliance to the orders of the Honorable Supreme Court of Pakistan. These proactive steps will definitely lead towards greater commitment and better health delivery at the doorsteps of the vulnerable people. Overarching issues of governance and monitoring still needed attention at the district and sub-district level. Expanded program for immunization provides immunization to children against the 7 vaccine preventable diseases under 1 year of age, that is childhood, tuberculosis, poliomyelitis, diphtheria, pertussis, neonatal tetanus, measles and hepatitis B. New vaccines like pentavalent vaccine have been introduced with the help of United Nations Children Fund. During the calendar year 2017, 8 million children of 0 to 11 months and 6.5 million pregnant women were immunized against 7 deadly diseases and tetanus toxoid vaccine, respectively. Though after devolution, this has become largely the responsibility of the region governments, but federal EPI cell currently took the responsibility of the procurement, coordination and technical guidance, whereas provisional EPI cells are largely responsible for implementation of the program. World Bank, along with other financial partners such as World Health Organization and Japanese International Cooperation Agency, has contributed for the smooth implementation of the program. Still, the issues of routine immunization in outreach areas of federally administered tribal areas and Balochistan need consideration. The number of injecting drugs users has posed a threat to increased number of total cases of the disease in Pakistan. According to National AIDS Control Program, the prevalence of HIV/AIDS is considered to be as low as 1%, not considered a high-risk country. The focus is on behavior change communication, services to high-risk population groups, treatment of sexually transmitted infections, and supply of safe blood for transfusions and capacity buildings of various stakeholders. Till date, 4,500 HIV positive cases have been reported to the AIDS control program at federal and provincial level. The program is technically supported by the United Nations agencies and Global Fund against AIDS, TB and malaria. Pakistan is ranked 6th among 22 high disease burden countries of the world. According to the WHO, in Pakistan, 40% of the burden of disease is in the form of communicable diseases such as malaria and tuberculosis. Incidence of TB stands at 231 per 1 lakh population and prevalence of about 300 cases per 1 lakh population. The National TB Control Program has achieved over 80% directly observed treatment symptoms coverage in public sector, and in the last 5 years the program has provided care to more than half a million TB patients. The program is moving steadily to achieve the global targets of 70% case detection. There are areas where NTP has to improve management, quality bacteriology, engaging all care providers through public-private partnerships, intersectoral collaboration, and evidence-based planning. Mother and child health has been one of the priority areas of public health in Pakistan. This program has been launched to improve maternal and neonatal health services for all, particularly the poor and the disadvantaged at all levels of healthcare delivery system. It aims to provide improved access to high quality mother and child health and family planning services, train 10,000 community midwives, provision of comprehensive emergency obstetric and neonatal care, services in basic and secondary healthcare facilities, provision of basic among services in 550 health facilities, and family planning services in all health outlets. Despite these modalities, Pakistan has shown a modest improvement, and the infant mortality rate, child mortality rate, and under 5 mortality rate are still very high as compared to the other countries in the region. Successful implementation will improve these indicators. Cancer is considered as one of the deadliest forms of non-communicable diseases, and the numbers of cases are increasing alarming. Pakistan Atomic Energy Commission's 18 cancer hospitals all over the country are providing diagnostic and treatment facilities to cancer patients. A state-of-the-art cancer hospital has been approved in 2016 to 17 to be constructed in Pakistan Institute of Medical Sciences, Islamabad, to provide cancer diagnostic and treatment facilities to the population of AJK, Fata, GP, and adjoining areas of Rawalpindi and Peshawar. The hospital will be completed within 5 years. Punjab Health Initiative Management Company was established to make progressive movement toward a universal healthcare coverage model, embracing the whole and deprived segments of the population, in which the needs of the poorest are specifically protected by the government and ensuring the availability and quality of essential services. Establishment of online registration of hepatitis B and C diagnosed patients for provision of free medicines was one of the important steps by the government of Punjab towards treatment of rising number of hepatitis patients. 24/7 Safe Mother ambulance service was initiated in rural areas of Pakistan for transfer of pregnant mothers to the nearest DHQ hospitals in case of complications. Government of Khyber Pakhtunkhwa extended its Sehat Insaf Card scheme to provide healthcare services to 15 million poor population in the province. Government of Sindh established its first pediatrics telemedicine clinic in Children Hospital, Karachi, with a focus to provide round-the-clock consultant service to the children. Ministry of National Health Services, Regulations and Coordination has established health planning systems, strengthening and information analysis unit in 2016. The key objectives of this unit would be to initiate strategic reforms in health sector to ensure universal health coverage which is sustained, purposeful and fundamental in nature. Sustained in the sense is that it is not a temporary effort and will have an enduring impact. Purposeful in the sense of emerging from a rational, planned and evidence-based process, and fundamental in the sense of addressing significant strategic dimensions of health system. Although devolution provides a window of opportunity, it must go beyond and introduce far-reaching reforms in the health and social sector. The main scope of unit are health planning and reform, align health system, strengthening activities in the country, health information analysis and its uses, provisional support and linkage. Malaria is the leading communicable disease in the country being major element causing morbidity in Pakistan. Some districts of Pakistan have high endemic incidence of malaria. Efforts have been made to eradicate malaria, but still some districts requires significant attention for its eradication. 66 districts of Balochistan, Fata, Khyber Pakhtunkhwa and Sindh shared highly malarial endemic disease picture, having annual parasite incidence greater than 5 per 1000 population. National Strategic Plan has divided districts in different stratas in accordance with extent to which they are affected. Balochistan fell in category 1 of strata that was highly disease affected. Successful implementation of the new funding grant for worth $52 million, secured worth $39.2 million to implement malaria control intervention in 66 districts of Pakistan under new funding request of Global Fund. Establishment of greater than 4,000 malarial diagnosis and treatment centers. Establishment of greater than 12,000 capacity building HCPs. Introduction of greater than 10 million long-lasting insecticide-treated bed nets. Conduction of greater than 1.5 million advocacy and awareness programs. Strengthening surveillance system. Improved surveillance and 65 plus 5 in district medical units supported districts. Conduction of monthly cluster meeting in Global Fund supported districts. Conduction of weekly watch charts and early warning in Global Fund supported districts. Arrangement of grant implementation. Global Fund grant malaria component has been arranged in 66 districts supporting Directorate of Malaria Control in 48 districts of public sector and toxic inhalation hazards in 18 districts of private sector. Prime Minister's Health Programme is a social protection initiative by providing financial protection cover to all people in phases, and the data of the Benazir Income Support Program will be used. Under this program provision of free of cost health insurance to 3.2 million families in Punjab, Balochistan and Fata in its two phases. Living below poverty line of $2 per day to access cashless health care services. Packages of 0.3 million rupees per family per year availability in both public and private sector through a health card issued by a highly transparent mechanism. Thousands of poor patients have been benefited from the treatment facilities including deliveries, cardiac surgeries, cancer and other major diseases in the best private and government hospitals in their districts without spending a single rupee. As of 31st January 2018, family has been enrolled in Prime Minister's National Health Programme and more than 56,000 families have been treated for various illnesses from 125 impaneled hospitals across Pakistan. There is also an option of inter-district portability in the program, which enables the enrolled beneficiaries and families to access quality indoor hospitals from any impaneled hospital both in public and private sector. In Pakistan, stunting, wasting and deficiency micronutrients are endemic issue due to dietary deficiencies, poor maternal and child health and nutrition, and high burden of morbidity. National Nutrition Program, the largest survey, has been initiated by Nutrition Wing at the federal level. It includes 120,000 households and district-specific data. It also includes water, sanitation and hygiene indicators, adolescents and childhood obesity, and the process is being monitored and supervised through national steering and national technical committees for National Nutrition Survey. Key achievements of the programs include development of national guidelines targeting different components of malnutrition, development of strategies for fortification, infant and young child feeding practices, IYCF communication, maintaining capacity building of provincial health departments on IYCF, revised community-based management of acute malnutrition guidelines, nutrition in emergencies, behavior changes communication on breastfeeding, coordination with provinces and other relevant stakeholders for wheat flour fortification and universal salt iodinization through National Food Agency and provisional fortification alliances. Establishment of IYCF committees at provisional level for planning and promotion of IYCF practices including breastfeeding. Establishment of infant feeding committees in provinces parallel to individual and family businesses for oversight. Successful expansion of community-based management of acute malnutrition for children in districts with high burden of acute malnutrition. Expansion of stunting prevention programs. Successful management of malnutrition among mothers. Implementation of behavior change about infant and young child feeding practices, especially breastfeeding by provisional DOH. Provision of supplementation targeting pregnant and lactated women, women of reproductive age and adolescents. Introduction of food fortification on larger scale. Establishment of stunting prevention program through support of UNWFP in Sindh, Balochistan, Khyber Pakhtunkhwa and FATA and in AJK. Implementation of large stunting prevention program in Punjab government. Since 2007, Pakistan has been signatory to International Health Regulation Convention with National Institute of Health based in Islamabad with a notified focal person overseeing reporting global health security agenda as a framework for IHR implementation was developed and launched after the outbreak of Ebola in 2014 to 15, highlighted weaknesses in certain areas of IHR. This led to the development of Joint External Evaluation Tool as one of the four components of a new framework for IHR monitoring and evaluation in collaboration with WHO Secretariat including GHSA. As preparatory steps for the GEE assessment, took several initiatives to streamline the process. These steps include re-notification of a multi-sectorial national IHR task force notification of national and provincial IHR focal persons, and a detailed orientation and sensitization of 120 participants, provincial and regional, from both health and non-health sectors. This enabled Pakistan to draw on the experience of all relevant departments and ministries to provide a comprehensive snapshot of the health system via JEE assessment. Ministry of National Health Services Regulations and Coordination has established health planning systems strengthening and information analysis unit in 2016. The key objective of this unit would be to initiate strategic reforms in health sector to ensure universal health coverage which is sustained, purposeful and fundamental in nature. Sustained in the sense that it is not a temporary effort and will have an enduring impact. Purposeful in the sense of emerging from a rational planned and evidence-based process, and fundamental in the sense of addressing significant strategic dimensions of the health system. Although devolution provides a window of opportunity, it must go beyond and introduce far-reaching reforms in the health and social sector. Well, development goals national framework includes Sustainable Development Goals, national priority targets, and target will be 2030. Good health and well-being. By 2030, reduce the global maternal mortality ratio to less than 70 per 1 lakh live births. Ensure healthy lives and promote well-being for all at all ages. By 2030, end preventable deaths of newborns and children under 5 years of age with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. By 2020, half the number of global deaths and injuries from road traffic accidents. By 2030, ensure universal access to reproductive health care services, including for family planning, information, and education, and the integration of reproductive health into national strategies and programs. Proportion of women of reproductive age 15 to 49 years who have their need for family planning satisfied with modern methods. Adolescent birth rate aged 10 to 14 years per 1,000 women in that age group. Achieve universal health coverage including financial risk protection, access to quality, essential health care services, and access to safe, effective quality and affordable essential medicines and vaccines for all. Coverage of essential health services defined as the average coverage of essential services based on tracer interventions that include reproductive, maternal, newborn and child health, infectious diseases, non-communicable diseases, and service capacity and access among the general and the most disadvantaged population. Number of people covered by health insurance or a public health system per 1,000 population. The government is dedicated to increase the health coverage To meet the growing demand of increasing population, health outcomes have improved over the years, but some critical weakness is a shortage of equipment and staff that continues to affect health system. There is a dire need to expand services delivery and address the shortfall in health-related human resources and making better use of technology. Public-private partnership need to be encouraged and coverage of public health programs like TB, malaria, hepatitis, and other communicable diseases need to be expanded. It is true that health and nutrition make important contribution to the economic development. Healthy people are more effective, are more energetic, and contribute in the economic progress, whereas ill health and disease individuals are considered as barriers to the economic growth. Delivering better health services has continuously been the prime objective of the government. Pakistan has a mix of public and private health service delivery system. About 38 million people die every year due to non-communicable diseases. Out of this, 70 to 80% deaths occur in low and middle income countries. About 18% of global deaths are attributed to elevated blood pressure. Over the last decade, the non-communicable disease burden has increased, resulting in a barrier to development goals including poverty reduction, human security, economic stability, and health equity. The increase in non-communicable disease can be due to increasing longevity and due to societal and cultural changes such as increasing illicit drug use. Pakistan is currently facing the double burden of communicable 38% and non-communicable diseases 50%, according to the WHO NCD Country Profile 2014. WHO Country Profile shows that in Pakistan, 25.3% individuals had high blood pressure, 19% had cardiovascular diseases, 3% had diabetes, 6% and chronic respiratory diseases. 8% had cancers, 23% were tobacco smokers, and 0.1% were alcoholic consumers. Center for Disease Control and Prevention works with several key public health institutions in Pakistan. CDC has partnerships with Pakistan's National Institute of Health as well as the provincial and district level offices to strengthen the capacity and infrastructure for key public health issues, including workforce development, hepatitis surveillance, and polio eradication efforts. CDC also has strong partnership with Aga Khan University to foster research in the areas of vaccination and neonatal infections. Despite the recent evolution of Pakistan Ministry of Health, CDC continues to conduct activities in Pakistan through its established relationship with provisional governments. Pakistan The CDC Pakistan, located in the Pakistan NIH, has worked closely with the GOP since 2006, served as a key technical arm during several public health events, including the human avian influenza outbreak in 2007. an HIV outbreak in 2008, the flood response in 2010, and the dengue outbreak in 2011. CDC joined the USAID Department of State's Biosecurity Engagement Program and the Office of Global Health Affairs in the Department of Health and Human Services supports this program. 33 public health physicians have completed this 2-year competency-based program, building a self-sustaining workspace in Pakistan. Currently with 18 residents enrolled, the program will implement a polio immunization track to provide assistance in 50 districts throughout Pakistan. In light of the recent evolution, all public health authority has been delegated to provincial health departments. CDC has supported the development of influenza surveillance in Pakistan through a cooperative agreement with the Pakistan NIH since 2004. 5 geographically representative surveillance sites have been established to conduct surveillance for influenza-like illness in outpatient settings and for severe acute respiratory illness in hospitalized patients. Prior to CDC funding, Pakistan had no laboratory capable of performing the diagnostic for influenza. CDC enhances the Pakistan capacity to design, implement, and evaluate the comprehensive tobacco control policy interventions through the Global Tobacco Surveillance System. CDC Global Initiative to Eliminate Folic Acid Preventable Neural Tube Defects by 2020, in conjunction with partners, provides technical assistance to establish folic acid fortification policies. The initiative also works to establish a global network of partners with expertise in birth defect prevention and surveillance activities, and to strengthen the regional and in-country birth defect surveillance to support neural tube defect prevention efforts. CDC has several projects related to the bacterial disease in Pakistan, demonstrating the impact of Hib vaccine in preventing the meningitis and pneumonia among young children in selected districts of Pakistan, determining the bacterial and viral causes of neonatal infections, supporting surveillance for the detection and characterization of agents of invasive bacterial vaccine preventable disease to provide data enabling GOP to make informed decisions regarding vaccination.